Namaste, I am Dr. Akshata Kamath, plastic surgeon at Apta Clinic, and welcome to another episode of Apta EmpowHer, where we decode women's health one podcast at a time. Today, I'm very happy to have Dr. Ramya Yethadaka. She is a senior consultant surgical oncologist and a breast surgeon in Mysuru. Ma'am, welcome to the podcast. Thank you for your time.
Thank you.
Since October, or as we call Pinktober, is Breast Cancer Awareness Month, let's dig deep into this mystical area of breast cancer, a little worrisome for all of us women. So let's know and be aware, and all of us as women have the right to know about breast cancer. So let's head in right away. My first question, ma'am, would be, why is breast cancer awareness important in today's world?
See, breast cancer is the most common type of cancer in women, especially in Indian women. Okay, so when we see into statistics, as per the recent Globocan data, so almost 2 lakh women get diagnosed with breast cancer every year. And we know that our statistics are not very accurate. So maybe the actual numbers may be 5 to 10 lakhs per year. So it is not only about the incidence. When it comes to cancer death, still breast cancer is the first important cause of cancer death in India. So almost 1 lakh women die because of breast cancer. Okay, so that's why we see a lot of cancer patients nowadays because of increase in incidence, maybe because of so many other factors. However, again, Indian data has told us that 1 out of 29 women in their life can develop breast cancer at any point of time. So almost 3 to 5% of that is a risk amount of people we are going to have in the next a decade or more is going to be horrible. So that's why we should be aware about breast cancer.
So ಈಗ breast cancer ಅಂದ್ರೆ ಒಬ್ರು ಫಾರ್ ಅ ವುಮೆನ್ ಯಾವ ಥರ ಸಿಂಪ್ಟಮ್ಸ್ ಬರ್ಬೋದು? ವಾಟ್ ಶುಡ್ ದೇ ಬಿ ಅವೇರ್ ಆಫ್, ಮೇಡಮ್? ವಾಟ್ ಆರ್ ದ presentations of breast cancer?
Very important. Again, everything depends on the stage at presentation. So when the breast cancer is in very early stage, they will just have lump which is painless. Very important to note, majority of our women come to me in very advanced stage because they think cancer is a painful condition. That is a misconception. Okay, so whenever there is cancer which happens in early stage, patient will not have any symptom other than a lump. So painless breast lump is the first important symptom in a woman. So ಸ್ತನದಲ್ಲಿ ಗಂಟು ಅದು ನೋವು ರಹಿತವಾಗಿದ್ರೆ ಅದನ್ನ ನಾವು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇರ್ಬೋದು ಅಂತ ಫಸ್ಟ್ ನಾವು ವಿ ಹ್ಯಾವ್ ಟು ಇವ್ಯಾಲ್ಯೂಯೇಟ್. The next other symptoms can be nipple discharge, which can be bloody discharge, greenish or even milky discharge, or even just a serous discharge. As the lump increases in size, then it can involve the skin or the underlying muscle. So when the skin is involved, there can be changes over the breast skin. Like we call it as pudy orange appearance. Andre kittale sippe tara iratte. So aa tara barbodu. That is when a patient has already reached stage 3. Or there can be ulcer over the skin, or there can be retraction of the nipple area complex. So all this happen when the lump increases in size to involve the dermal lymphatics of the skin.
Okay, ma'am.
Then when it goes to the lymph node, then the patient can present as a lump in the armpit.
Okay.
That is called as axillary lymphadenopathy. As the stage progresses, patient can still develop a lymphedema or swelling of a ipsilateral arm. ಕೈ ಊತ ಆಗೋದು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ನ ಸಿಂಪ್ಟಮ್ ಇರ್ಬೋದು ಬಿಕಾಸ್ ಆಫ್ ದ ಆಕ್ಸಿಲರಿ ಲಿಂಫೆಡಿನೋಪತಿ. Patient till they reach stage 4, they will not have any symptom like breathlessness or fatigue or weight loss, nothing will happen. ಸೊ ನೀವು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ ಅರ್ಲಿ ಸ್ಟೇಜಲ್ಲಿ ನೋಡಿದಾಗ ಅವರು ನಿಮ್ಮಂತೆ ಇರ್ತಾರೆ. ದೇ ವಿಲ್ ನಾಟ್ ಹ್ಯಾವ್ ಎನಿ ಸಿಂಪ್ಟಮ್ ಆಸ್ ಎಕ್ಸ್ಪ್ಲೇನ್ಡ್ ಇನ್ ಅ ಮೂವಿ ಆರ್ ಎನಿ ಅದರ್ ಕಾಮಿಕ್. They will not have any symptom of cancer cachexia till they become stage 4. Okay, so very important, because we should not neglect the early symptoms. Breast cancer is a curable condition.
So at the end, I think every lump, be it big or small, it needs to be examined, evaluated.
Correct.
Ma'am, lot of people bartare nange bari breast pain ide and they're worried that they might have cancer.
Correct.
So is it commonly associated with cancer or not, ma'am? Just breast.
Again, Akshata, I have not explained pain as one of the symptoms.
Yeah.
Because pain in breast cancer is tumma kadime. It happens only in 5% of early stage breast cancer.
Yes.
Or when it becomes very advanced, like stage 3 or 4, because of the associated infection or nerve involvement or muscle involvement, pain can happen. So pain less is important.
So only breast pain
Might
is not
not
be associated, but if we have any doubt, I think it's better to reach out to a breast surgeon as soon as possible. Now, how do we know, ma'am? How do we diagnose ourselves? How do we keep a check? And from what age should we start keeping a check?
So any girl after the age of 21 should do her breast self-examination. Okay, this is called as know your breast better. So you know about breast yourself better than anybody else. So what we have to do is we have to do monthly breast self-examination. I'll just give you a brief explanation.
Yes,
so there are 5 steps of breast self-examination. So any girl after the age of 21 should do once in a month. The best time is to do once she completes her menstrual cycle. Means if today is the first day of menstrual cycle, day 8 to day 10 is the best time, because there is no hormonal abnormality. Breast engorgement will not happen because of the hormonal changes. So there are 5 steps. Step 1, 2, 3 is to see. Step 4, 5 is to feel. So in step 1, a girl or a woman should expose herself in front of a mirror, examine how is the shape, size, how is the nipple area complex looking. Okay, then in step 2, raise the arm above the shoulder level to look for a masked area of the breast that is called as inframammary crease.
The lower aspect
Correct.
of the breast.
So that get exposed when a woman raises her arm above the shoulder. So even when you raise the shoulder, there can be some changes in the skin. Those can be again symptoms of breast cancer, like a retraction of the skin you can make out. So step 3, you palpate or touch the breast in a circular manner. So we should not poke or pinch the breast. That is again a common misconception. They come to me saying that there is a lump, but the way they look into is will be different. Okay, so these are called as pulse of finger. So with that, gently we have to rotate our palm, feel for the breast, feel for any underlying abnormality like lumpiness or nodularity. Do it in a circular manner. Finally, behind the nipple area complex. Do the same on the other side. In step 4, the nipple area complex need to be gently squeezed between the thumb finger and the forefinger to look for any discharge from the nipple. Step 5, in lying down position, repeat the step 3 and 4. So these are the 5 steps which takes only 3 minutes.
Yes.
This is the easiest, simple, free of cost test. These are called a screening test. Okay.
So anybody who is above the age of 21 can do a self-examination at least once in a week.
Once in a month.
Once in a month will be enough.
Yes.
And I think that helps a long way.
Correct.
Because always early detection is equal to better outcomes.
Correct.
And what about breast screening, ma'am?
So again, breast screening, breast self-examination, one screening modality. The other, we all know, it is mammogram. Mammogram, it is not very hi-fi or any invasive technology. It is as simple as doing a X-ray.
Yes.
Because breast is a 3-dimensional structure, the X-ray will be taken in 2-dimensional. So there will be 2 views where we do mammogram. So it is nothing but doing an X-ray of the breast. Why mammogram is important and when we should do it? Mammogram is required to be done once in a year for all women more than 40.
Okay.
Why not below 40? Breast is very, very dense below the age of 40. When we take mammogram in a younger age group, the whole X-ray or the image looks very dense.
Okay.
Means we will not be able to make out any changes. So it is wiser to do a mammogram after the age of 40. So what is the advantage of doing a mammogram after 40? Even when you can't feel a lump, mammogram can detect a non-palpable lump.
Okay, ma'am.
Very importantly, something called as microcalcification. Microcalcifications are features of something called as ductal carcinoma in situ, which are precancerous, which can be treated easily. So these can be picked up very easily with mammogram. And whether doing a mammogram every year increases the cancer risk? No. The amount of radiation exposed in mammogram is significantly lower.
Very less.
Yes.
So what about now? I've seen, ma'am, I think that there is an early detection of malignancy in younger age group.
Correct.
Say 30, early 30s, 35.
Correct.
What kind of tests help in this age group?
Yeah. So after the age of 21, once they start doing breast self-examination, if they come with any symptom, they have to come across to us. So in younger age group, ultrasound is the first modality by a good experienced radiologist so that they will not miss malignancy. Majority of younger women will be in their peripartum age, means they may be pregnant or lactating, and these lumps will be usually misdiagnosed as galactosele or mastitis or abscess. So doing the ultrasound with the experienced radiologist is very, very important. So when we have suspicion, we even ask for MRI of the breast for few patients.
Okay. And
however, ultrasound is the initial modality.
Okay. And what kind of suspicion are you talking about, ma'am, in terms of going ahead with an MRI? What kind of suspicion?
Again, the radiological characteristics with our clinical diagnostic features will...
So once ultrasound is done, even after that, if you want a confirmation, we go for a test called MRI of the breast. Now that we have discussed about symptoms and how to diagnose it and ways to diagnose it, ma'am, if a woman of, say, my age group, we come in with early breast cancer, what are the latest treatment options available?
So previously what we used to do is, even if a patient comes with 1 centimeter of lump, we used to remove the entire breast. That is called as total mastectomy. That is not the case now. So there are 3 important modalities in breast cancer treatment. One is surgery, other one is systemic therapy in the form of chemotherapy or immunotherapy or oral medication, other one is radiation. So surgery acts as a very, very important role in treatment of cancer. However, it all depends on the stage. There is something called as receptor status. So in breast cancer, we do 3 immunohistochemistry tests. Those are called as ER, PR and HER2/neu receptor. So it all depends on the stage, receptor status, breast size to lump size ratio to plan for further treatment. If a woman is a candidate for breast conservation surgery, means I don't have to remove complete breast. Breast can be preserved with just removal of the lump with the normal surrounding tissue. That is called as breast conservation surgery or BCS. So after the lump is removed, there will be a cavity left behind, right? So that will be reconstructed. Obviously, you know better than me. So that is called as local oncoplasty. So after this, the next treatment depends on the receptor and other status, as I've already told.
So early detection means better outcomes even in terms of breast conservation, conserving the architecture and the shape of the breast.
Correct.
It is possible now.
Correct.
And there is a stigma among all women saying, my God, breast cancer means they're related to very, very negative things like even death. So what do you have to say to that about outcomes nowadays in breast cancer?
So again, it all depends on the stage and the biology of tumor. All patients with cancer don't die. So cancer is not a death sentence. We can cure majority of patients if they come to us in very early stage. So as the stage increases, the survival decreases. That's why we keep telling that please come to us in early stage. Yes. So in stage 1, we can have a very high cure rate of 96 to 98%. As the stage reduces to stage 4, selected patient we can cure. Those are called as oligometastatic disease. So they can have survival up to around 15 to 20%.
Okay. Ma'am, coming to preventable causes that are known to us that can be prevented and causes that cannot be prevented. Most important, genetics.
Exactly.
Ma'am, can you talk about that?
Yeah. So preventable causes are the ones which we have control over it. So majority of cancers nowadays are related to lifestyle. So these are all lifestyle related diseases like any other non-communicable disease like diabetes or hypertension. So one is our lifestyle itself. Obesity is a very important risk factor for breast cancer. So it is actually a very, very preventable cancer cause. Other one is the food what we eat. We don't know how polluted or what are the chemicals we have. So those all we have control over.
Processed foods,
Exactly.
obesity, lifestyle,
Yes.
alcohol and smoking is, I think, one.
One more important is a woman, if she has delivered and fed her baby before the age of 35, then her cancer risk reduces.
Okay, ma'am.
If the age at first pregnancy and delivering and feeding a baby is after the age of 35, the cancer risk almost doubles.
Okay, ma'am.
The other thing is history of previous something called as atypical ductal hyperplasia or precancerous condition if they had, even the risk of cancer increases.
So they should be constantly and frequently screened
Yes.
for any malignancy or cancer lumps.
Correct.
What about this? Everybody talks about how Angelina Jolie got her, she prevented her the cancer by removing both her breasts and getting it reconstructed. So why did she do it, and what is your take on it?
So Angelina Jolie, as we all know, she underwent something called as prophylactic bilateral mastectomy with prophylactic bilateral salpingo-oophorectomy. Not because she had cancer, she was just a carrier for something called as BRCA, or what we call BRCA gene mutation. Her mom is a ovarian cancer survivor. So when they diagnosed her to have ovarian cancer, we do genetic cancer testing called as BRCA 1 and 2. Those are the most common hereditary cancer related genes. So when she was diagnosed to have, obviously the offspring also underwent. So Angelina Jolie was a carrier. When BRCA mutation is tested to be positive, the risk of breast cancer increases up to 40 to 60% lifetime. Even the ovarian cancer risk increases up to 40 to 80%.
Okay.
So these are the risk reducing treatment options available.
Okay.
So we don't do public BRCA gene mutation testing. It is only for selected patient. Like if there is young breast cancer lady below the age of 50, if there is triple negative breast cancer, or if there is cancer involving both the breast, or if there is a family history of male breast cancer or ovarian cancer, these are few of the indications to do BRCA gene mutation.
How young do you advise them to do it? Suppose a grandmother or a mother has been diagnosed. How young would you suggest the index person to undergo the test?
So it is usually 10 years younger than the first previous
detection.
Yes. Or after the age of 35, whichever is
So this is a blood test that you do,
This is the
simple
blood
blood
test.
test that you
Yes.
do, and the reports come in.
almost 10 to 15.
And how do you decode the reports, ma'am? How do you make?
So there is something called as pathogenic, non-pathogenic, or the in-between called as VUS. Variant of unknown significance is there is a gene mutation present, but we don't know whether the genes are pathogenic or not. So it all depends on the test report. However, doing a test is not important. In our society, counseling them is very, very important. Because what we see nowadays is when a family has breast cancer, we have seen people not giving them a job. We have seen them, their offspring or their children not getting married, and the society, how they...
huge stigma.
Yes. So it is not about getting diagnosed or getting the genetic testing done. It is about how we counseling them and the society regarding the same.
Coming towards the end, what would be your take on how people are getting diagnosed now? I think they're getting diagnosed earlier.
Correct.
And the surgical outcomes and their lifestyle has also evolved that they're doing. I've seen a lot of patients who come confidently and say, I'm a breast cancer survivor, I survived and I'm back to my work.
Correct.
And they have well reconstructed breasts that look almost normal because of the various advances in terms of onco and plasty.
Correct.
So what is your final take to women during this breast cancer awareness month? It's a very sensitive yet important issue that needs to be discussed. So what would be your take on it? A few words.
So according to me, not because I am a lady surgical oncologist, lady or a woman is a power to her house. Okay. So you can see when we get fever, the whole house will be disrupted. So just imagine a lady having advanced breast cancer who requires months together of treatment. How bad is the house getting shattered? So if you come to us in early stage, we can diagnose, we can treat it very easily without need for multiple modalities of treatment for many of patient. So don't delay or don't neglect your own health. Health is very, very important. Rest all comes secondary. So simple screening tests are available. Make use of it. Spend few penny for the same every year. So any changes in the breast, see, it might not be breast cancer all the time. Lump in the breast is not cancer all the time. However, only we can rule out.
Yes.
General public will not be able to rule out. Okay. So any lump or any symptom in the breast or anywhere in the body, don't neglect. If any symptom persists for more than 3 weeks, visit oncologist or physician or whoever you trust. Get it evaluated, get treated. Okay. And breast cancer is curable if it is detected and treated in early stage.
And I think the mindset of every woman, especially in India, is to keep herself last.
Exactly.
They never come forward. They say, ivattu naale exam ide, magalad exam ide, illa nam husband ooral illa, illa mane nodkobeku. So I think putting ourselves first, that has to be highlighted.
Correct.
And that's when we put our health first. Why? Not because we're being selfish. Because as you said, we are the bearers, we are the torch bearers in the household. We take care of not just the house, but outside. We are employed, we have our jobs, but we also are the main pillars at home. So I think it's very important to keep us healthy first.
One more important, Indian population has been found to be developing breast cancer in very early stage compared to Western population.
Why is that?
Maybe because of our genetic association or our environment. We don't know the cause yet. So we see young women as young as in their 20s, 25s who have just delivered or who have just finished their exam or who are just joined their job getting breast cancer nowadays. So lump even in the age of 15, 16 or 20s should not be neglected. Or even lump or any changes in the breast after lactation or during lactation or during pregnancy should not be neglected.
Okay, ma'am.
So any symptom persisting more than 3 weeks should never be neglected, should be evaluated thoroughly to rule out cancer.
And how often have you seen the incidence of breast cancer in men, ma'am, here in Mysuru?
Yeah. In men, it is almost 1:100. So if 100 ladies develop breast cancer, it is 1 man who can develop breast cancer. So lump or changes in the breast even in a man should not be neglected because even they have breast.
Yes. So that is, I think, one very important fact, that breast tissue with gland and fat is present in men as well.
Correct.
So I think we have to always be aware of the any changes that happen in our breast, both in men and in women. Ma'am, thank you so much for all the time and all the important pearls of knowledge that you have given us. I think it's very important, and it's very important to not be fearful of what may happen, but to tackle our health, and if there's any doubt, to go to the specialist as soon as possible.
Correct.
Thank you so much, ma'am.
Thank you. Thank you, Akshata.
Thank you.